Welcome to the Crime Victims Community in COVID-19 Kickoff Webinar and Roundtable Conversation. Thank you all so much for taking an hour out of what must be an insanely busy time for you. My name is Renee Williams. I'm the Executive Director of the National Center for Victims of Crime. We are the nation's leading organization representing crime victims and the organizations that serve them. I'm going to be guiding us through the next hour with the help of my teammates, Danae Johnson, who is our Chief Programs Officer at the National Center, and Deidre Watford, who is our Chief Communications Officer. In a very short time frame, this team has organized this webinar, and we are happy to announce that we had over 1,100 registrants, suggesting that there's this profound interest in our victim service community in inquiring more information about what's going on right now. So Megan, next slide, please. A little bit about this community and our overarching goals. You all have come together in incredible ways to support victims on the front line in times we never thought we would see. And the National Center wanted to start this as a way to support those of you who are on that front line and doing this incredibly important work in what must be extraordinary and trying circumstances. We're so appreciative of everything you're doing. We want to assist you and support you in any way that we can. And so to that end, we have several goals for this group. The first is to create a national community where service providers can share new and unexpected challenges, innovative solutions, and develop best practices. And frankly, if you need to, we want to make sure you can just vent with each other. So to that end, we've created a Facebook group that Deidre is going to share details about a little bit later. We'll be launching that at the end of this seminar. Please make sure you join that group. On that point, we also want to make sure that we are sharing the most relevant information with you in real time. So all of that will be posted to the Facebook group. We want to make this a one-stop shop for everything that we come across that is relevant and current, whether it be OBC guidance, CDC updates, guidance from our network of experts, anything that we find that we think is helpful. We won't be pushing these things out through email as we don't want to clutter your inboxes, especially in this time. So that Facebook page will be your point place. We also want to provide you access with experts in our network for a variety of fields on a variety of topics, whether that be the stimulus package, considerations for nonprofits, self-care tips, anything we see as a trending issue. We want to make sure that you have access to experts on that. So to that end, we will be holding bi-weekly webinars with experts to provide guidance with each topic. Finally, and I hate using old adages, but this one's good. You've seen people say necessity is the mother of invention, and I have found myself saying that now. I'm sure a lot of people in this group have seen floating on Facebook. There's a quote about Isaac Newton, who developed the theory of gravity while he was quarantined from the plague. This is our time to make great advancements in how we deliver services to victims that can impact us when we aren't in the middle of a national crisis. So we want to make sure we're harnessing all of these issues, all of these questions, and importantly, all of the innovations we are seeing coming from this crisis, and use it to develop new ways to serve victims, develop protocols and preparations for the future. And a lot of what comes out of this group will go to that. So next slide, Megan. A little bit about today. This is only the beginning of what we believe will be many conversations. We obviously cannot cover everything today, and we can't go into a lot of details, but we want to focus on what we can achieve. So the first part of today, we're going to provide a brief overview of guidance that we've come across, provide you with some very basic first steps of things you shouldn't be thinking about and strategies you should be looking at. A few things to point out. During this part, when we're just walking through guidance, we're going to keep you all muted. Now, I know a lot of you have become very familiar with Zoom technology in the last 2 weeks, but I still saw a lot of questions when people were jumping in. So just to clarify a few things, there are two different functions on Zoom for communication. There's the chat, which all of you are using, and that's awesome. Keep using that. We won't be monitoring that as closely, but we will pull it at the end, and we'll be pulling all of your comments from it. So please keep chatting with each other and use that to answer questions and talk to each other directly. There is also a function that we will be monitoring. If you can see it at the bottom of your screen in the little black band, it says Q&A. That our team will be monitoring. Any questions you have for us that are formal questions, go ahead and ask it there. and we will try to get to each one. We will do our absolute best to answer those questions, or at least to come back to them. If we don't get to them during this webinar, we will make sure we get you responses within the next week. Again, we may miss some things during this webinar, but we'll be reviewing everything, and we will do our best to come back. After the guidance, we're going to open up the agenda to a roundtable, and we're going to discuss some questions that we've prepared, as well as let everyone weigh in on some of their challenges during this time, and we want to look at innovative solutions. So again, this is going to be the first of many conversations. Our goal today is really to provide you with some basic information and to really get our arms around what you all are facing, determine next steps, and come up with some solutions for you. One last quick note for everyone. This webinar and all of our webinars will be recorded. This one is being recorded so that we can make them available to this community at a later date. If you need to leave for any reason at all, or if you think of a question later, please don't hesitate to reach out to us. We are happy to provide this recording to you, and we are happy to answer any questions we can. And you can reach out to us either through Facebook or through a special email that we've set up that Deidre will share later. Okay, so that is the end of a very long-winded and lengthy introduction, but before we get into the good stuff, next slide, Megan, we'd like to get a quick feel for the room. So just some questions to answer. Are we doing this on a poll, or are we doing this in the chat? Poll. Okay, so some poll questions. Go ahead and pop those up. Okay, so you'll see. Getting to know the audience. If you could answer these, and this will just give us an idea of how we should tailor our presentations going forward and what you all need to know from us. And then we'll pull them at the end and look at everything, and we will be sharing these results at the end. So thanks in advance for filling all of that out. Okay, next slide, Megan. While you all are doing that, I'm going to turn this over to Danae Johnson. Danae is, again, our Chief Programs Officer here at NCDC, and she's going to be talking about the OVC and DOJ guidance that we've received so far.
Hello, everybody. I am pleased to give you the information that OJP and OVC have provided us on guidance for this COVID-19 experience that we're all going through. I'm going to be very specific with what I am providing you, just to not deviate from any of their guidance. If there are any questions relevant to the information that I'm providing you, it's vital that you contact your grant monitor, as we won't be providing any specific guidelines to your grants if you are in fact an OJP grantee. On March 19th of 2020, the Office of Management and Budget issued an OMB memorandum, M2017, Administrative Relief for Recipients and Applicants of Federal Financial Assistance directly impacted by the novel coronavirus COVID-19 due to loss of operations, affording federal awarding agencies with additional flexibilities to provide administrative relief to funding recipients affected by the loss of operational capacity and increased cost due to the COVID-19 crisis. The Office of Justice Programs, OJP, provides the following short-term relief for various administrative, financial management, and audit requirements under 2 CFR Part 200, Uniform Administrative Requirements, Cost Principles, and Audit Requirements for Federal Awards. Please keep in mind that in accordance with M2017, these expectations are limited, and flexibilities afforded to federal awarding agencies will be reassessed by OMB within 90 days of the issuance of its memo. Notice for grant recipients. Until further notice, unless otherwise specifically stated below, OJP is suspending the requirements for grant recipients to seek prior approval and to process grant adjustment notices, GANs, in relation to the items discussed below that would normally require prior approval and/or a GAN. Grantees should maintain a copy of this guidance with any other appropriate records and cost documentation in their grant file. Notice for cooperative agreement recipients. While cooperative agreement recipients may benefit from an administrative flexibilities outlined below, OJP is still requiring prior approval and grant adjustment notices for any cost and project changes related to cooperative agreement awards. Recipients should contact their OJP program managers promptly to discuss anticipated changes. In keeping with its accountability as a pass-through entity as applicable, to ensure that subrecipients receive any necessary guidance and information on requirements and subrecipients would need to meet so that their recipient may meet its own responsibility under the award. The recipient should take appropriate measures designed to ensure that subrecipient records, including leave policies and cost documentation pertinent to the award, are maintained consistent with the notice and as required, consistent with 2 CFR Part 200. Allowability of costs not normally chargeable to your award. OJP will allow recipients to incur costs related to the cancellation of events, travel, or other activities necessary and reasonable for the performance of the award, such as the cost to providing telework equipment to employees who are working on the award, or the pausing and restarting of grant-funded activities due to the public health emergency, to charge these costs to their award. OJP will allow recipients to charge full cost of cancellation when the event, travel, or other activities are conducted under the auspice of the grant. In cases where charging of cancellation or other cost results in insufficient funds to eventually carry out the event or travel, please contact your grant manager to discuss possible alternatives or changes to the scope of the project if feasible. Allowability of salaries and other projects costs. OJP will allow recipients to continue to charge salaries and benefits to the award consistent with the recipient's policy of paying salaries and benefits under unexpected or extraordinary circumstances from all funding sources. As outlined in 2 CFR 200.431, and benefits may include the cost of leave, regular compensation paid to employees during period of authorized absences from the job, such as for annual leave, family-related leaves, sick leave, etc., administrative leave, and other similar benefits, as long as they are provided under written leave policies. OJP encourages recipients to review and update, if necessary, their written leave policies to address unexpected or extraordinary circumstances. Recipients are required to maintain copies of the leave policies and cost documentations to substantiate the changing of salaries and benefits during interruption or operations of services. Award extensions. In accordance with the Part 200 uniform requirements and consistent with the DOJ grants financial guide, most OJP awards may be eligible for one no-cost extension up to 12 months. If the grant has previously received a no-cost extension and an additional extension will be requested due to the extenuating circumstances occurring in connection with the public health emergency, refer to the DOJ grants financial guide for additional information and consult with your grant manager as needed. Please note that the awards funded by the Office for Victims of Crime or any other OJP Bureau program office under the provisions of the Victims of Crime Act of 1984 are available during the federal fiscal year of the award, plus the following 3 fiscal years. OVC and other OJP bureaus and program offices have no discretion to permit extensions of any awards prior of performance beyond the statutory period. Closeouts and extensions. Grantees need additional time to complete closeout requirements, such as submitting final financial performance and other reports and deliverables requested by the terms of their award. should contact their grant manager before the closeout deadline, which is 90 days after the award ends, to request prior approval of an extension. Please note that the Grants Management System, GMS, will continue to send automatic closeout notifications, which can be disregarded. Financial reporting requirements. For grantees unable to meet original due dates, OJP is allowing delayed submissions of up to 60 days for federal financial reports for the reporting period January 1st through March 31st of 2020. GMS will continue to send automatic delinquency notifications, which can be disregarded. However, grant funds will not be withheld unless the FFR has not been submitted by June 30th. Please note that at this time, due dates for reports for the remaining fiscal year are unchanged. Grants payments. The Grant Payment Request System, GPRS, will remain in service to accept and process grant payment requests. Progress reporting and performance measures reporting. For grantees unable to meet original due dates, OJP is allowing delayed submissions of up to 60 days for progress and performance measure reports due in March and April of 2020. GMS will continue to send automatic delinquency notifications, which can be disregarded. Please note that at this time, due dates for reports for the remaining fiscal year are unchanged. Programmatic and financial monitoring. Until otherwise notified, all planned on-site monitoring will be conducted as remote monitoring or postponed for a later date. You will be contacted by your OJP grant manager and/or financial staff or OJP Office of the Chief Financial Officer to make alternative arrangements. If your organization is unable to participate in remote monitoring due to operational limitations, you may request postponement until a later date. OJP sponsored conferences, events, and other gatherings. For OJP sponsored conferences, meetings, trainings, and other gatherings that are scheduled in the near term, cooperative agreement recipients should work with their OJP program and grant managers to set up meetings as virtual events or postpone or cancel meetings. For events planned farther out, please work on a case-by-case basis with your grant manager. With prior approval and a grant adjustment notice, OJP will allow cooperative agreement recipients to charge full cost incurred for postponing or canceling an event, travel, or other activities under the grant. In cases where charging of cancellation or other costs result in insufficient funds to eventually carry out the event or travel, please contact your grant manager to discuss possible alternatives or changes to the scope of the project if feasible. SAM registration. 60-day extension to sam.gov registrants will, with expiration dates between March 19th, 2020 and May 17th, 2020 will automatically be initiated. This effort is expected to be completed by March 28th, 2020. Single audit submissions. In case where OJP serves as the cognizant agency or has oversight for a recipient's audit, it will allow grant recipients that have fiscal year end through June 30th of 2020 and that have not yet filed their single audits with the Federal Audit Clearinghouse as of March 19th, 2020, an extension of 6 months beyond the normal due date. Please note that recipients taking advantage of this extension will still qualify as a low-risk auditee under the criteria of 2 CFR 200.520A, criteria for a low-risk auditee. Lastly, solicitations. Solicitations with the original application due dates between March 16th and March 31st have been extended by 2 weeks. OJP will continue to monitor the situation and determine if additional adjustments to closing dates will be needed. Grants.gov and OJP's grant management system remain open to continue to accept applications. Please direct questions about guidance on your OJP grant to your OJP grant manager or to OJP's Office of the Chief Financial Officer by calling the Customer Service Center at 1-800-458-0786, TTY 202-616-3867, or via email at ask.ocfo@usdoj.gov, and we will provide all of those contact information points to you.
Great. Thank you, Danae. So I was watching and trying to respond to the questions that came in through chat and Q&A, and to confirm with everyone, we are recording this and we will provide this recording to you all. We will also do our best to get you the information that we stated so that you can have it going forward. We've also received some pretty extensive guidance from the CDC in regards to operating in homeless shelters and in community facilities that we thought was relevant for you all. So just so you know, the CDC is encouraging everyone to promote the practice of everyday preventative actions: wash your hands, cover your mouth when you cough and sneeze. Please provide COVID prevention supplies at your organization and have these supplies on hand for staff, volunteers, and those you serve. Plan for volunteer and staff absences, and we're going to get into that a little bit. Jackie, we are going to provide you with a copy of the PowerPoint as well, I promise. Please make sure that you're preparing now for volunteer and staff absences. If possible, identify spaces within your organization that you can use to accommodate clients with mild respiratory symptoms. Make sure you're separating them from others, especially if you provide shelter services. Minimize the number of staff members who have face-to-face interactions with clients. And if you keep sleeping areas, please keep those mats and beds at least 3 feet apart and request that all clients sleep head to toe. So the CDC, again, has provided some amazing guidance. There are a lot of one-pagers. We are going to make all of those available on that Facebook page. If you're curious, in the meantime, we've included that website for you, but also there is coronavirus.gov, which is a information. We will be putting it on Facebook. Next slide, Megan. We also want to cover the stimulus package because there are a few important provisions that you all as nonprofit professionals should be aware of, both professionally and personally. First, in this bill itself, which is only phase one, there is specifically about $350 billion in grants set aside to nonprofits and small businesses. This is specifically, though, to help with labor, workforce expenses, or to cover essential functions, which would be paying rent, paying your mortgage. These are available to 501c3s who, importantly, do not receive Medicare funds. That is a huge distinction. The experts that I've talked to in this field are indicating that there are going to be several phases of legislation as it relates to coronavirus. They believe that there are going to be a lot more grants and other opportunities available to nonprofits, but it won't be until we're in about phase 4 of that legislative process. We will keep you in the loop as we receive updates, and that is one of our planned webinars. There are provisions for individuals that you should all also be aware of. They address affordable housing and homelessness services. The full bill is available at HR 748, which is the CARES Act, Corona Aid, Relief, and Economic Security. And again, as we get details, we will provide those to you. Next slide, Megan. A couple of more considerations that we wanted to go over because they really impact this community. And we are gathering information as we speak. And as we get it, we will make it available to you. What are courts doing? As of right now, 34 states have suspended in-person criminal proceedings and 13 have reduced in-person proceedings to what is necessary. In most states, jury trials have been suspended. There is a state-by-state breakdown at themarshallproject.org, and I'm going to spell that out. It's themarshallproject.org. Again, there's a state-by-state breakdown. As far as civil courts go, for the most part, civil courts across the nation have closed. They are only accepting e-filings. Many states have already announced a tolling to any statutes of limitations, which I know affects your clients. We've prepared a chart internally that we are releasing and we will make available to you, detailing what each state is doing as far as statutes of limitations and next steps. Nonprofit considerations. I know many of you have in-person meetings and conferences that you're worried about. We do too. We have some guidance as far as force majeure contract provisions. Our attorneys are telling us that in most cases, these conferences will be canceled with no fee from your hotels and vendors. We will make that guidance available to you. And we will also try to get a panel expert on that to be speaking to you. Again, I encourage each of you to begin operation strategies now. NCVC itself has a staffing plan in place that we developed within a few days of this taking hold. Please be prepared if staff members fall ill, have written contingency plans that are being communicated to staff. And I encourage anyone on the phone, if your organization does not have this in place or if you've not heard about it, please reach out to your management and ask them what the plan is. We are happy to find examples of these plans and develop any assistance in developing these that we can provide. We're happy to do that. Technology is at the tip of everyone's tongue right now, and I know it brings a lot of concerns regarding not only privacy, but victims' sense of feeling safe and open when sharing their stories, especially for those advocacy organizations. It's a little bit different to do it virtually than when you're in a safe space in a room. There's a wonderful site called techsafety.org. They have an entire corona response kit on their page. They're wonderful, and we're going to try to have them in to chat with you all as well if you think that's important. Finally, one thing that we want you all to consider, practice good self-care. We all have to take care of ourselves right now as well as each other. I know a lot of people are already doing this, but things to consider. We've had virtual happy hours at NCVC. Wednesday, we are having a virtual pet meeting, which my cats will be joining, much to their dismay. I encourage everyone to do that and to figure out ways to really stay connected with your organization, with your coworkers, and with your community. A few things that I found personally helpful, just so you all know, there's an organization called Yaymaker. They host the paint nights that popped up around the nation where you go to bars and drink and paint. They're offering virtual paint events for 15 bucks. So Yaymaker's great. Coursera, which is C-O-U-R-S-E-R-A, they have a multitude of free courses online, including The Science of Being Happy, which is Yale's #1 class. Masterclass is a little bit expensive, but they are currently holding a buy one, get one free special, which I split myself with my friend. I Venmo'd her 90 bucks and we both got Masterclass for a year. And finally, YouTube has wonderful guided meditation videos. They have meditation for sleep. They have exercise courses, all of which is free. So please check all of those out. If you're going stir crazy, make sure that when you're taking care of victims, you're also taking care of yourself. And so with that and more on self-care, I'd like to actually introduce Charity Hope, who's the Deputy Director of the Center on Victimization and Safety, to talk about what they are doing. Charity, go ahead.
All righty. Good afternoon, everyone. Thanks, Renee, for the intro. And thank you to NCVC for inviting me to join today. As Renee mentioned, I'm the Deputy Director of the Center on Victimization and Safety at the Vera Institute of Justice, and one of the conveners of the National Resource Center for Reaching Victims. I'm here to do a couple of things today, to share a little bit about the National Resource Center for Reaching Victims, who we are, and then a little bit about what we do, especially around the rapid response measures and resources we have been working to develop in response to COVID-19. Also, I'd like to point out my cat in the background for those of you that can see. So for those of you also that are thinking about working remote or have recently worked remote, I'm sure you have a lot of colleagues, new colleagues, human and otherwise, right? Partners, cats. She decided to bust in a little earlier for this meeting, so. But back to it. So the National Resource Center for Reaching Victims is a one-stop shop where victim service providers, culturally specific organizations, criminal justice professionals, and policymakers can get information and expert guidance to enhance their capacity to identify, reach, and serve all victims, but especially those from communities that too often have less access to healing services and avenues to justice. The Resource Center is a collaboration among several organizations, Common Our Latino, Casa de Esperanza, Common Justice, Forge, the National Children's Advocacy Center, our host today, the National Center for Victims of Crime, the National Clearinghouse on Abuse in Later Life, Women of Color Network, and the Vera Institute of Justice. We have several communities of focus at the National Resource Center, including victims who are children and youth, older adults, boys and men of color, women of color, people with limited English proficiency and immigrants, LGBTQ victims, people with disabilities and deaf individuals, and formerly incarcerated victims. The Vera Institute of Justice, my organization, is both the convener of the National Resource Center for Reaching Victims and also leads that center's efforts around improving services for both formerly incarcerated victims and people with disabilities and deaf victims. So that's just a little bit about who we are. You can take a deep dive into the National Resource Center more at reachingvictims.org, and we'll also share that link in the chat. So what are we doing right now? Now, when we're not in the middle of a pandemic, we are providing training and technical assistance on meeting the needs of the communities I just listed. For the last several weeks, we have pivoted all of our training and technical assistance to focus on a rapid response to sustaining services for survivors and victims during COVID-19. Our goal at the National Resource Center is to ensure that as we all adjust to this unprecedented time, that we do not lose sight of the needs of already underserved and marginalized victims. To date, we have hosted 5 national strategy sessions as town hall style forums with victims advocates and national TA providers and other experts to sort of, raise issues that we're all experiencing, struggling with right now in this, I don't want to say new normal. I don't want to call it normal because it's not normal, but in this unprecedented time, and to really put our heads together to problem solve as these issues arise. I know that in the Q&A earlier, there were a couple of folks asking about Zoe Flowers. We have actually been hosting weekly Staying Grounded sessions with Zoe, leading advocates through a guided meditation, because we know, as Renee mentioned earlier, now more than ever, we're all looking for sort of outlets to take that moment to take a breath and to really focus on our self-care. And we have always, we've also hosted sessions on tele-advocacy and working remotely, as we know that a lot of organizations are trying to pivot to continue providing services, providing advocacy to clients, residents, participants remotely, but also at the Vera Institute, we had a core of us that worked remotely before, I'd say maybe 50 out of our entire staff of 350. As of a few weeks ago, we have 300 new remote coworkers. So we understand that that is a big change for a lot of folks. A couple other things that we are also doing, we are hosting community-specific listening sessions. So far, we have hosted 3 listening sessions, one on survivors with incarceration histories, one on deaf survivors, and one on survivors with disabilities. And I don't think the email has gone out yet, quite yet. So now's your chance to go to reachingvictims.org and sign up for the email before we hit the send button. But we are going to announce a series of new listening sessions. There are some taking place in Spanish over the next couple of weeks. And then we'll have listening sessions on sustaining services for children, older adults, LGBTQ victims, immigrants, girls and women of color, and boys and men of color over the next several weeks. So if you want to get looped into those updates, you can sign up at reachingvictims.org. And then just one final thing, we are also working on creating a centralized repository of information for sustaining services for our communities of focus. Through our strategy and listening sessions alone, we've received hundreds of questions. We know that folks are struggling with, how do we work with victims and survivors to enhance their safety when they may not, they're at home and they may not currently be in a safe place. Those kinds of questions to where can we get money for laptops and video conferencing services so we can maintain some level of service, to how do we file protection orders when and if courts have shut down most services, to how do we ensure victims are notified when the person responsible for their crime is released from jail and prison. So there's lots of questions percolating out there, lots of questions about working remotely, lots of questions about tele-advocacy. And we know that we may not as individuals have all the answers, and a lot of times it requires expertise and collaboration and us putting our heads together to really figure out sort of, where do we go from here in this unprecedented time. So we are in the process of creating a database of some of these critical and are working with a diverse sort of set of experts to figure out a way to get you those answers. So again, if you want more information about the National Resource Center for Reaching Victims, you can go to reachingvictims.org, and you can sign up there in the contact. There's a section where you can sign up for our newsletter or just to contact us. That will automatically get your email on our distribution list, and we can get you this information. So huge thanks to NCVC for allowing us to be part of today's presentation. And I know that everyone is doing their best to center all victims during this time. I know that we are in an unprecedented time and trying to move forward. And we may not have all the answers, but we certainly are stronger together than we are individually. So thank you again so much for having us in NCVC. And if you want more information, check us out at Reach.
Thank you, Charity. And just a reminder, we're in all slide in both where you're helping other and in our Q&A. We're not going to today, but I promise we are back to them. There are several, and we will provide as we can. We do want to focus on our survey results. You all have a good understanding of what we are seeing around the country and what the trends are. I want to thank each of you who participated in the survey we sent out. I'm going to ask Deidre, our Chief Communications Officer, to quickly review those results with you. Deidre, do you want to take over? Deidre, you're on mute.
Thank you, Renee. Good afternoon, everyone. Thanks so much for joining us. Like Renee said, we conducted a survey. It was from March 24 through March 27, and we received 404 survey responses for during that period. And I just want to take a moment and kind of go over our survey results. I'm actually intrigued with the number of participants that have signed on today. And so although I'm sharing results from 404 of you, I know for a fact that the information that we are garnering on today is just going to help extend our ability to provide the guidance and services that we are all searching for, as Charity said, during this new, we don't want to say new normal, but during this new period here. But Megan, can you go to the first slide? So when we asked the respondents to tell us a little bit about who you are and who you served, more than half of you responded that you do provide resources to victims. The second most common victim population was for domestic violence and sexual assault victims. And then we had a smaller population serving elder abuse, fraud, human trafficking, and child abuse. Again, this was based on a survey results of 404. I know that there's many more out there, and so based on the information we get today, I'm sure that that will grow. Next slide, Megan. So we also asked about the services that you provided. Nearly 100% of you responded that you provided resources. 25% said that those resources were for shelter victims. 15% said that they were for providing housing. There was a smaller other percentage that was cited saying that they provided legal services, mental health services, emergency referrals, training, and case management services as well. Next slide, Megan, please. So when we asked how many of your organizations were implementing and encouraging self-care practices, it was a very nice number, almost 90%. It was a small 11% that said no. Now, I do have to cite that a lot of the respondents were saying that they're now working from home, and that they are also, they were not having difficulty obtaining protective equipment from the government. So with regards to encouraging self-care practices, they were saying that they were all good. So next slide, Megan. So again, with the results for PPE, 61% said they have not begun using protective equipment, but that again loans itself to a large majority saying that they're working from home now, so that may not be something that is necessary. But again, wanting to make sure that they've also cited that they're not having difficulty obtaining protective equipment. Next slide. Okay. When we asked if you were feeling that if your organization was prepared to offer help for the victims during COVID-19, over half said yes. We had 8.5% that felt that their organizations were not prepared to provide services. The comments stated that they were unsure whether their organization is prepared to continue providing services because so much is unclear and subject to change. So that was a huge concern there as well. Next slide, Megan. So when we asked to describe the challenges that your organization was facing, a huge challenge was technology, and I believe Renee kind of touched on that earlier. But a lot of things that you guys were saying was you're not being able to hold meetings and to attend your appointments and have the home visits that are included in your regular service provision because of the lack of technological support. They're saying that you're having to scale back your services due to uncertainty. You are concerned about court closures impacting your legal resources for your victims, and you're also concerned about not being able to provide students with the services that they are needing due to school closures. A lot of you have also stated that you are lacking the ability to have meaningful collaboration on projects and programs with your coworkers while remote because of technological challenges. So again, I believe Renee provided a website for, I think it was techsafety.org, that has a great toolkit on their site. So hopefully some of these resources that we're going to provide you with can help us maneuver through these challenges that we're facing. Next slide, Megan. So we also asked, in what ways have you been able to serve the populations that you are working with, and what they are actually needing. And the most common response was that people were asking for assistance just on basic needs: foods, cleaning products, toilet tissue, paper towels, that sort of thing. A lot of respondents also reported that they are concerned about losing housing due to loss of income, and they're also seeking information about tenants' rights. So there's a legal aspect there. They also were concerned, the ones that were living in shelters were concerned about shelters closing or scaling back the amount of assistance that they could offer due to COVID-19, and therefore they not having, or their family not having, anywhere to go. And then again, with the legal concerns, they're concerned about the impact of court closures on their circumstances. And what does that mean? Is it, will everything just continue with postponement, and will they be okay? Or will they have to, find other ways to go about moving forward in that legal space? So those are some of the concerns there. Next slide, Megan. So we also, you skipped one, go back one again, thank you. We also asked, with regards to referrals and caseloads, what is the impact that COVID-19 were having? And many of you reported a reduction in caseloads due to agencies closing and scaling back. Responses do not reveal an influx of caseloads. So you have a reduction in caseloads. There's not been an increase in caseloads, basically is what you're saying. And as for continuing operations, you have had success in making referrals while working from home without issue, but I don't know that it is then translating into additional caseloads. So that is something else that we can try to look into a little bit more and try to help provide resources there. Next slide, Megan. So the final question we asked was how the National Center can actually help your organizations as we go through this COVID-19 season, and it is just only going to be a season. You've asked us to continue publishing updates related to COVID-19. I believe Renee also shared a great website, which is coronavirus.gov. They are doing a fabulous job of keeping everything updated on resources and new updates as they come about. You've asked us to keep providing guidance and resources for working and serving victims remotely. You've asked us to help spread awareness about hotlines and services that are open and available during this time. You've asked us to provide trainings and also provide information on funding opportunities. You want us to continue publishing information on how COVID-19 impacts marginalized communities and underserved victims. And I think Charity did a wonderful job introducing her organization with all of the resources that they are bringing to the table. You want us to continue assist coordinating efforts to get aid and relief to victims in need of food, shelter, and basic needs. So that's something that we can all work together in trying to move forward in. And you've asked us to continue compiling information about promising practices for keeping people safe while they are isolated with abusers. So a lot of this talks to what Renee was saying earlier with regards to future polls and surveys. Again, we've had over 1,300 participants on today. These survey results were based only on 404. So once we garner the information from the polls that were held on today, we can actually come back and provide additional resources and assistance based on the information you provided on today. We are also posting a Facebook page. The name of the page, and I will provide the link in our chat, but on Facebook, our page is Crime Victims Community in COVID-19. And I will provide that link in the chat, and it is also a link at the end of this presentation. I will make sure that everybody gets that. So it's a new Facebook page. Please like us, and we will be posting information daily on all of the resources and all of the information that we come about with regards to COVID-19. I think what Renee said it best, it is going to be at that portal where we just start to interact with each other, sharing information, if needing be, to vent. Just it's where we can all come together as one. I will kind of hook onto what Charity was saying. We're all in this together. There's not one of us that can do something without the other. So I say, I love the fact that we've come together today. I'm looking forward to being part of this new community that we are ushering in so that we can actually help each other make it through to the other side, because this is only a season. It is not a new norm. So I thank you for your participation today, and I look forward to future webinars and surveys so that we can continue to service you.
Thank you, Deidre. Now, we are running a little bit behind because we only planned an hour, and I know you all have a lot of really important things to do. We're going to pop up another quick poll to help inform us. Megan, if you could pop that poll up. And while you all are answering the poll questions, we're going to move right into our roundtable. So we have a couple of questions that we have planned. If we go to the next slide as well. Yep, keep going. Sorry, thank you. So if you all can chat, what are the best ways for you to access the latest updates? We keep saying this Facebook page, but if there are better ways, what from this group do you think would be the best way? And if you want to answer in chat or unmute yourselves, you're welcome to do so. But I'll let everything roll in. So we're getting some email responses, weekly email updates, Twitter, email. So as we're talking about that, because everybody's coming in saying email, I'm very sensitive about bombarding people's email, especially now. Do you prefer a weekly digest? Oh, some people can't Facebook. Okay. Okay, weekly digest. Do you think a listserv would help if we set up a listserv where you could all reply to each other? Because we can digest weekly listservs or daily listservs, but I don't want to bombard people again. Listserv. Okay. Okay, next question. No to listserv. What are some of the specific technologies you all are using to implement these new practices? And I will tell you, as you're answering that, we cannot endorse or recommend specific products, but I can tell you that I've heard what other organizations are doing that you might want to look into. There is Zoom, there is an organization called WebEx, Adobe Connect, Skype, Microsoft Teams, Google Hangouts, Free Conference. We use Slack at NCVC, and we also have GoToMeetings. Many of these services are free. You're all getting a chance to use Zoom right now, and you can see it's pretty handy. Almost all of those services also have mobile applications. So again, we can't encourage any of them. I cannot endorse them, but just so you know, that is available. There's also, of course, FaceTime for smaller meetings, WhatsApp for texting, and Viber for other things. So let's go to question 3. And I think we've covered some of this, and we've definitely seen your questions come in, and we will be responding to those questions. But if there are specific ways that we can help right now beyond pushing out this information, what are some of the specific ways that we can help you directly? Okay. I'm going to let everyone start typing if there are specific ways. I'm sure that this is a little bit more of a long response. Weekly updates. Yeah, we will be providing weekly updates and weekly webinars. Were there any more questions we had for the group? What opportunities are you seeing that are currently available? Is there any other questions? I'm going to give everyone. Okay. So again, if you all email us, if you answer on that Facebook group, we will try to pull together all of those responses and be pushing out webinars with experts, because certainly we don't have all of that information, but we will definitely be trying to provide it to you all. Next slide. Our next steps, please let us know how we best serve you. We will be trying to provide future webinars on all of these things. So if you come up with ideas, please feel free to email us. We have a special email address set up for this. It's cvcc@victimsofcrime.org.
Yes.
Please be emailing that address. We will push things out to you, and we will send all of our webinars out. Please join the Facebook group. We'll be pushing everything out on there too, and we will look at doing weekly email updates for this group. We will set up a listserv, but you certainly do not have to join it, and we will walk you through how to set up a daily digest through that listserv so you're not getting an insane number of responses. Deidre, do you want to repeat the Facebook group name again very quickly?
Sure. It is Crime Victims Community in COVID-19. And I have put that in the chat along with the bit.ly code that will take you directly to the page.
Perfect, thank you. So again, we'll look at the listserv, look at that for a little bit. We are looking at providing more long-term information. And I think that's why we started this group, so we can be looking very much into the future. I really want to thank my amazing team for putting this together so quickly and on short notice. Again, we wanted to make sure we were there for you, and I'm so proud of how we pulled this together. But in turn, I've been asked by my team to make sure that we express our heartfelt gratitude to each and every one of you for all of the just incredibly important work that you're doing in taking care of victims of crime, not only in these really extraordinary circumstances, but every day. I think this panel proved that there's a need for discussion. So please join us, and please let us know if there's anything else we can do to help you in this time. Thank you everyone so much for joining us today. And have a great rest of your week. Bye.